With the warmer weather in full swing, it's often women who admit to feeling uncomfortable in bathing suits, but for some guys, it can be the same situation. And joining us now is Dr. Beth Collins. She's back to talk about some of the issues that men might face during the summer. And we're actually talking about a condition, Dr.
Yeah, absolutely. Something that's actually really common. It's called in the science world gynecomastia. If I could be a little bit more, man boobs would be the other term for it that people would use. And it's a really embarrassing thing for men, but surprisingly common. It's actually prevalent in about probably upwards of a third of the population of men. Yeah, and there are two peaks of time that it happens. It happens once in adolescence, right around puberty, and then goes away in a lot of those boys all by itself. And then another time between the ages of 50 and 70.
Really?
So yeah, and they're in about a third of men who feel really uncomfortable, may not mention it, but don't want to go out on the beach and take off their shirts because there's a little bit extra tissue in their breasts.
And it necessarily isn't a matter of, say, somebody loses weight, you can still have it moving forward, correct?
Yes, yeah, absolutely. It is a little bit more prevalent in somebody who is overweight, but really the condition is too much breast tissue. So it's a benign condition. There are some things that can cause it medically. So if there is a problem, it's just, if you have this extra breast tissue, it could be on both sides or on one side. If you have it, you need to check out other reasons because there are other things that cause gynecomastia, like some medications that you could be taking, some problems, even testicular cancer can cause it sometimes with the hormones floating around. But ruling out the vast majority of the time that you have this problem, it's just for no reason at all. It's just you have a little bit of extra breast tissue as a man.
Now, is this something that a certain medication can end or?
Not really. If it is caused by something like a medication, coming off that medication, of course, can reverse it. Yeah. But a lot of times, if it's caused for no reason at all, no, it's not. You know, the only thing that you could do is really surgically correct it.
And that's one of the things that you provide, correct?
Yes, absolutely.
So tell us a little bit about the procedure.
So it's a combination of some liposuction because there is fat associated with it as well, but there's also a bit of breast tissue under there. Men have breast tissue too and could also get all the problems that women could get in their breast tissue, so it's important for men to always be checking for lumps and things like that. But you go and through a small incision just underneath the nipple, you take out that extra breast tissue to flatten it all out. It's about a week or two recovery, and then, you know, things start to look a little bit better. People taking off their shirts in the summertime feeling
flexing
a whole lot
on the
better.
Beach a little
Absolutely.
Bit. Now how about the mental aspect of it? How are some of the patients feeling afterward? I'm assuming they're feeling a little bit more confident and, as you said, going on the beach?
It's a really wonderful thing, actually. And my favorite patients are some of the younger kids who have hit puberty and have this problem and feel so self-conscious. And they come in, and I've had boys who couldn't even look at me when they first came in because they're just so shy about taking off their shirt. And then we correct the problem, and the next time they come in, I see a completely changed just confidence, and it makes people feel better, of course.
Now, I'm assuming that some parents are out there saying, I wouldn't want my kid to go through a procedure like that, or it might be a little too radical. What would you want to say to those parents?
Well, I think that there is a place for waiting some of these out, because in some of the pre-pubertal boys, it will resolve itself in time. But after a certain point, you know, a 14-year-old boy getting through who's really having social problems and not going out and doing things with his peers because he feels self-conscious, I really see a benefit in their personality and in their self-confidence, and I think it helps them. It's a very safe procedure. It's not high on the risk scale. So if you could benefit from it a whole lot more, then I think it's something worth exploring. Okay, very good. Well, we invite you to head on over to Dr. Beth's website, BethCollinsMD.com, and always look out for her tips every single week here on CT Style. We love the tips, all the beauty tips, you know. It's all great.
I love them. So we're going to be showing you some of those throughout the month. Dr. Beth, thank you so much for joining us today here on CT Style, and we'll see you soon. We're going to send things over to Teresa.